All right, now there's one other section to the standard, and it's an annex, or an appendix, which is normative. It means it's mandatory. And it's called Appendix A. And it is required for healthcare facilities. Why is it there, and why is it in a special annex? Why is it separated from the rest of the standard, so to speak? It's actually not separated. It's part of the standard, but it is in a special annex because of the unique requirements and word requirements, really, for healthcare facilities. Annex A is normative. That means it's mandatory for compliance, and it is written with the healthcare professionals in mind who are often managing building water systems in hospitals. So there are criteria specified for healthcare organizations that have infection control professionals already working in this infection control area. The language used is consistent with the language required for these healthcare facilities to integrate their water management programs in with all the other infection control activities they're already doing. So really it's mostly about getting the language and the concepts consistent for healthcare. And therefore, this Annex A deals with really all the same issues, all the same principles, and in fact many of the same requirements verbatim. However, it's organized in a way that flanges, that aligns with the healthcare regulations and words that are used already in the industry. So Annex A requires a designated team, that's a water management team, a water system flow diagram, a great description in it. There's exactly the same process flow diagram we described before. A risk management plan that has these elements, a team members with specified contact info and responsibilities, water system flow diagram, systematic evaluation of hazardous conditions, exactly the same. Now this is a little different than other building types. A risk characterization to identify areas where probability of infection is highest. And so this is an activity that healthcare professionals are already very active in because, of course, in a hospital or any kind of healthcare facility where inpatient work is done, there will be areas of the building in which highly vulnerable or susceptible patients are located. And so a risk characterization across the building to identify areas where risk of infection is highest, of course, is a requirement. It's a natural thing to do. It's a necessary thing to do in a healthcare facility. And this may not be relevant for another building where patients of different susceptibilities might be located. And then finally, procedures for prevention and control of Legionellosis is specified by the risk management team. They identify control locations, determine control limits, develop monitoring procedures, determine corrective actions, assign responsibilities, documentation, the same exact requirements as for all other buildings. And then disease prevention responses with specifics for infection control professionals and infection preventionists. And of course, other building types don't have people on staff with this kind of training. And so that's why Annex A is really very helpful in providing a framework that includes these infection control professionals. Existing buildings, new construction and renovations. And then the last part of Annex A is building water system procedures. And these correspond exactly with the same procedures given in section 7.1 through 7.5. So as you can see, Annex A is an important part of the standard, very important, as it relates to healthcare organizations, very consistent conceptually, fundamentally with the rest of the standard, but also in the language necessary to make the water management program consistent with all the other infection control activities that go on in the healthcare environment.